Is dystonia permanent if caused by schizophrenia medication? Have you ever wondered what happens when a medication for schizophrenia leads to movement disorders like dystonia? This is an important question, especially for those navigating the complexities of mental health treatment. Dystonia can be a side effect of antipsychotic medications, which are commonly prescribed for schizophrenia. So, let's break down what this means for individuals experiencing these symptoms. Dystonia can appear in different forms depending on the type of antipsychotic medication used. Acute dystonia is one type that occurs shortly after starting or increasing the dosage of these medications. It causes sudden and often painful muscle contractions. The good news is that acute dystonia usually resolves quickly. With prompt treatment, symptoms can improve within 12 to 48 hours after stopping the medication or using specific treatments like anticholinergic drugs or antihistamines. On the other hand, tardive dystonia is a different story. This form develops after long-term use of antipsychotic medications and can be more persistent. It is part of a broader condition known as tardive syndrome, which also includes tardive dyskinesia. Tardive dystonia can be disabling and may not fully resolve, even after stopping the medication. This can significantly affect a person's quality of life due to ongoing muscle contractions and discomfort. When it comes to permanence, acute dystonia is generally not permanent. However, tardive dystonia can be chronic and may not completely go away. In adults, it often affects specific body parts and can be somewhat manageable. In children, it may progress more extensively, which can be concerning. Treatment options vary based on the type of dystonia. For acute dystonia, immediate treatment with anticholinergic drugs or antihistamines is effective. Tardive dystonia, however, requires a different approach. Medications like deutetrabenazine and valbenazine are sometimes used, though their effectiveness for tardive dystonia is not fully established. Other treatments may include clonazepam or even deep brain stimulation in severe cases. For those living with schizophrenia, regular monitoring for signs of dystonia during treatment is essential. Early detection can help reduce the severity of symptoms. Using the lowest effective dose of antipsychotics for the shortest time possible can also minimize risks. Open communication with healthcare providers about any new or unusual muscle movements is vital for adjusting treatment as needed. In summary, dystonia caused by schizophrenia medication is not always permanent. Acute dystonia is typically reversible, while tardive dystonia can be more persistent. Understanding these differences is key to managing symptoms effectively and improving overall well-being.